Good day, sir. I am Ricah of BSN1-D, and today I will demonstrate how to give a tepid sponge bath to a client. So the purpose in doing tepid sponge bath is to reduce or lower the patient's body temperature to the normal range. So for the assessment, the first thing that we need to do is to identify the client. We can ask their name, check their tags, or also ask their relative. So after that, we need to explain the procedure to the client so that we will know or they will know how they can cooperate. Then after that, we need to check the patient's body temperature. So for planning, the first thing that we need to do is to arrange all articles that we're going to use. Next, we need to provide privacy. We can do that by closing the door, by drawing the curtains. After that, we need to close the window and also the air conditioning unit. And then after that, we need to raise the bed to a comfortable working height and also raise the side rails. So after that, we need to ask or invite a relative or a family member or a significant other to assist us with the procedure if desired. And then next is we need to offer a bed pad or urinal to the client if desired also. And then after that, we can wash our hands and wear gloves. So since gloves are not available, let's just imagine that I am wearing one. So for the implementation, the first thing that we need to do is to loosen the top sheet. And then replace it with a bath blanket. After that, we can now assist the patient to the side of the bed. And after that, we can now remove the patient's gown. Then after that, we can now pour a tepid water to the basin, and I already prepared one. Then we can now soak the washcloth. We need to make sure that the washcloth is wet, adequate enough, just moist but not dripping. So we need to put a washcloth to the patient's axilla and groin. We need to do this to reduce the body's temperature or reduce the fever. So we need to do that for 3 to 5 minutes, and let's imagine that we've already done it for 3 to 5 minutes. We can now remove it. We need to place a rubber pad under the patient. Then after that, we need to place a bath towel under the patient, over the patient's chest rather. And wash the cloth. Soak the cloth. Okay, now sponge the patient's face and neck using S strokes. Then pat dry it. Then after that, we need to ask the patient to hold the bath towel. Then we can now sponge the chest. For the face and neck, we need to do that for 3 to 5 minutes. And then for the chest, we need to use long, firm, long light stroke. Chest and the abdomen. Then we need to pat dry. After that, the upper extremities. Put a bath towel under the patient's arm and then use also long patting stroke. Then pat dry also. And then now with the patient's lower extremity. Pat dry. Then after that, if the patient is complaining of feeling chilly, we can skip the chest and abdomen part. After that, we need to reassess the patient's pulse and body temperature and observe the patient after doing the procedure. Next is we need to assist the patient to turn, and then we need to sponge her back and pat dry it. Put a towel under her side to avoid the blood from getting wet. Using long then pat dry. Then after that, we can now change the patient's gown. If the patient has an IV line, we need to start with that hand. Then we need to cover the patient with the top sheet. Then we can now clean the area and wash our hands. So for the evaluation, we need to check the temperature, respiratory and pulse rate after doing the procedure. After that, we need to assess signs of fever, redness and warm and so on. So for the documentation, we need to chart the body temperature before and after the procedure, other manifestation related to fever, time of rendering the procedure, and the patient's response after the procedure. So that would be all. Thank you.